What is opioid use disorder? This is the most current nomenclature, the name used to describe addiction. The medical community and psychiatry community are getting away from the words dependency, addiction, abuse, and replacing it just with a general term that covers all of it, and this is opioid use disorder. Another term is opioid misuse. This encompasses all types of drug use that involves opioids. So when I say opioids, I mean drugs like codeine, dextromethorphan, which is in cough syrup. Those are the gentle ones. Then there's tramadol or Tramacet, and then Percocet, Vicodin, oxycodone, oxycontin, and finally the heavy hitters like morphine, heroin, and finally fentanyl. So these are all the main drugs of abuse that are in the opioid class. And if a person is using them, is it possible for a person to use these sporadically without developing some sort of dependency of some sort. These drugs are so powerful and so strong that it draws a person into the addiction spiral for most people. A casual user is very rare, especially with the heavy-hitting drugs at the high end of the spectrum, but some people can use casually things like a half a pill or any amount of pills of Percocet or Vicodin. But what happens for most people is they may use sporadically in the beginning, and they progressively use more and more. This is the problem with these class of drugs because they're safe in short-term use. There's nothing wrong with using them as prescribed up to a week or so for an acute treatment of acute pain. But what happens is people end up they feel well on these drugs. It's not only helping their physical pain, but can also help their emotional pain. It's sometimes a stress reliever, and I actually called it a happy pill. I felt happier and more awake when I was taking Percocet. So like I said, the problem is that most people cannot control their intake. They go through withdrawal fairly quickly off these drugs, so should they cease taking it, they would feel uncomfortable generally within 24 hours or so. The rare user who can use once in a while, like I said, is very rare. So for the most part, it is considered a disorder because the person is requiring more and more of the medication to achieve the same effect. So this is what we call tolerance, and they will go through withdrawal should they stop taking the medication, and this is called dependence. So those, all of the above can include people with opioid use disorder because this describes the dangerous addiction spiral that affects all aspects of their life. It could be, for most people, it's a deteriorating spiral where they require more and more amounts of the drugs to achieve the same effect. But the problem with that is that they will go through a more serious withdrawal because of the higher intake of the opioids. So this is why it's a disorder. Not to mention all the complications it has on a person's quality of life. In the beginning, when they're going through acute withdrawal, they can start missing school, work. They lose interest in activities that normally gave them joy. There's deterioration of relationships with loved ones. They lose their friends. They burn bridges with people. So this is a general broad strokes description that I'm giving, but this is my best way of explaining why this is a disorder and why it belongs under this terminology. So to summarize, opioid use disorder or opioid misuse describes the whole gradient from somebody who's using sporadically, like as a weekend warrior, somebody who rewards their behavior or working hard during the week, where this is at the light end, and at the heavy end is that this person can start developing tolerance. They can increase their use, and before they know it, they're addicted, meaning that they're dependent, meaning that if they were to stop, they would go through withdrawal and feel very uncomfortable. And this is what perpetuates the spiral of deterioration in the addiction. So finally, the worst end of the spectrum is somebody who's using the more potent opioids, things like morphine, heroin, and fentanyl. These are more dangerous because they're more potent and they work more rapidly. People who are using heroin tend to use intravenously. Some people do smoke it, but it's the intravenous abrupt introduction into the body that causes problems. They get high quickly, but they come down quickly. The same thing goes on with fentanyl. So this helps demonstrate why it is that opioid use disorder covers a wide spectrum of disorders and use. It is a disorder for almost all people who are using them, with the exception of some people who can curb their use, and people who are chronic pain patients who do take their pain medications as directed according to their doctor and try to wean down once they're feeling better.